Hello, dear viewers and listeners. I'm Monica Kuzminskaite, health and nutrition psychologist, and this is my podcast that I call Spoonful of Reason. This week, we discuss pro-inflammatory and anti-inflammatory diets. Chronic systemic inflammation is the strongest link between the diet, physiological aspects, and mood, psychological aspects. Depending on the foods we choose, the body's immune system can remain constantly active, damaging the nervous system and disrupting the neural signals. Scientists currently agree that connection between the gut, the brain, and the immune system influences mood. If the diet consists largely of highly processed foods, refined sugar, and trans fats, it promotes the release of pro-inflammatory cytokines, for example, IL-6 or TNF-alpha. These cytokines can cross the blood-brain barrier, enter the brain, and cause inflammation of neural tissue there. It affects serotonin production and promotes mood-related behaviors characteristic of clinical depression and anxiety symptoms. The Mediterranean, and Nordic diets are considered anti-inflammatory diets. They are rich in foods high in polyphenols, omega-3 fatty acids, and fiber. These substances support the health of intestinal lining and inhibit the cascade of inflammatory reactions. Recent scientific studies routinely use the dietary inflammatory index, or DII, as one of the most significant tools for predicting mood. Dietary changes are recommended for the treatment of major depression and are considered to be just as effective as medication. Research findings also suggest that women may be more sensitive to the effects of a pro-inflammatory diet. Foods with a high dietary inflammatory index are associated with higher likelihood of experiencing symptoms of depression and anxiety in women. Pro-inflammatory foods also starve beneficial gut bacteria, leading to lower levels of short-chain fatty acids, for example butyrate, in the body, which are essential for maintaining stable mood and counteracting brain fog. Furthermore, research findings indicate that the negative effects of unhealthy diet not only contribute to symptoms of depression or anxiety, but are also associated with increased risk of ADHD, bipolar disorder, and cognitive decline symptoms. If you would like to improve your mood through dietary changes, consider the following recommendations. Make sure your diet always includes the three essentials: omega-3 fatty acids, fatty fish, walnuts, or chia seeds, polyphenols, berries, dark chocolate, green tea, and magnesium, leafy greens or pumpkin seeds. This will help to suppress the production of cytokines that fuel inflammatory responses. Aim to eat about 30 grams of fiber daily. Gut bacteria break down fiber into anti-inflammatory compounds that soothe the brain's immune cells or microglia. Identify hidden sources of inflammation. Reduce your intake of highly processed foods, artificial sweeteners, and emulsifiers, for example, polysorbate 80, which is also known as E433. Um, all of these substances, they disrupt the health of the intestinal lining even when they're low in calories. Try to manage glycemic spikes. Rapid rises and falls in blood sugar levels stimulate cortisol release and oxidative stress, both of which promote inflammatory response. If you are reading this, then at the end of the text you will find links to several most recent and most relevant scientific research articles, as well as recommendation of 3 books on this topic. I'm Monica Kuzminskaite. I'm a health and nutrition psychologist. I help to resolve simple and complicated issues related to emotions, behaviors, and thinking. I write, I give lectures, and I provide psychological counseling. You will find the link to register for counseling session in the comment of each post, and you will find my posts on social media searching either for my name or for keyword Spoonful of Reason. Wishing peace to you all.